And we are back. Last month, we talked about laser center services over at Fayetteville Plastic Surgery. This June, for Dr. Edward Dickerson's The Aesthetic series, we're going to be talking about hair restoration this Thursday. And then in 2 Thursdays, we'll be covering everything you need to know about weight loss. Dr. D is here in the studio today. Dr. D, how are you?
Oh, thank you, Jacqueline, and thank you, WIDU, for having us. Should be a fun time.
Yep, and today we also have Rachel Kugelman and Tara Thornton from Fusion Salon in downtown Fayetteville. Rachel, how are you?
I'm great. Thanks for having us today.
Hello, Tara.
Hey, we're excited to be here.
Can you girls tell me a little bit about Fusion? I'm not familiar with the salon.
Fusion Salon is located downtown at 304 Hay Street. We are an 8-chair salon. We've been there about 8 years now, and we do all types of hair. We're Tuesday through Saturday and Thursday nights late.
Awesome. Now, Dr. D, let's get straight to business here. We're talking about hair restoration. Can you just give us a quick overview about what you provide over at Fayetteville Plastic Surgery in terms of services?
Thanks very much, Jacqueline. And usually, a lot of my clients come at the direction of their hair specialist. So to be able to provide and share some information with each other, I think is really going to benefit our folks that are hair challenged, if you will. And we have both, first of all, non-surgical as well as surgical options. Some of those non-surgical options include low-level light therapy, where people can wear looks like a little skateboard helmet at home, and I think we're going to go into a little bit more of that later. But there's also prescription medication as well that we can do, because not everybody needs a hair transplant or is a candidate for a hair transplant. Now, for those individuals who do need a hair transplant, we can do those in our office. We don't have to go to the hospital. It's usually an all-day affair, and we have some of the most latest technology that requires no cutting, no incisions, and no longer that bad, row of corn hair that looks like somebody just popped in like a Barbie doll, if you will. So we're really, really pleased to provide that state-of-the-art follicular unit extraction, as we call it.
Awesome. Now, Tara, can you tell us a little bit about the people that go to your salon? What types of hair loss do you deal with just with your regular clients?
Well, definitely all types of people, men and women alike. A lot of our ladies notice it more in the front, just like men do. It doesn't really discriminate against any ethnicity or any type person. Anybody is a candidate for hair loss, and a lot of it's just genetics.
That's great to hear, because there's a lot of misconceptions, even just about everybody thinks it only happens to the older people.
And it can happen to anyone, and it can happen for a number of different reasons. And a lot of times when we can't figure it out or can't make it better, we send them to someone like Dr. D who can help them further than what we can do for them.
Dr. D, what would you say is the most, I don't want to say popular, but the more mainstream issue that everybody comes in for?
The biggest thing that people start to see is, or they will talk to their hair specialist that, I'm seeing a little bit too much more scalp than I did a few months or a few years ago. Or I am seeing more hair on my pillow or more hair in the sink. And, as we continue to mature, those things are once again may not have been such a priority back 15, 20 years ago, have not only, let's say, raised up in our priority scale, but also in our value scale. So once again, how do we make sure that we do not age or give the appearance of aging prematurely? And of course, either hair loss or graying of the hair can do that faster than what we want. And so, even when I was a kid or a young man, there was nothing better than a fresh haircut, so to speak. Lines or edge, you had a good looking suit. And that goes the same for the ladies. If you've got the gorgeous dress, the car looks good, but you are just not feeling it from, let's say, the eyebrows up, there's that sense of confidence. And, you've been to our place before, and what's our mantra? If you are confident, you are beautiful. And so the ability to give them that self-confidence where they're not avoiding mirrors or looking for them, I think it's really fantastic. And we're going to even talk about some of the little tricks that we can do, just before even church, so it doesn't look like that light is shining through because we've teased it up so high. How do we thicken hair with simple over-the-counter products like keratin fibers? We've seen those in Sally's Beauty Salon. I think Topic is one of the makers that we have. And I mean, literally, for those individuals who come to see me for a hair transplant, we sprinkle a little keratin fiber, we match their hair color, and literally in 5 minutes, we go from trying not to look in the mirror from can't stand out of the mirror, so to speak.
Now, what exactly is hair loss?
Hair loss, the $17 word that we all use, am I correct, is alopecia.
Yes.
That just means loss of hair. People have been diagnosed with alopecia. Well, you could have done that just by looking in the mirror, if you will. But now the question is, what is the cause of it? As Tara mentioned, genetics is really the most common. A female pattern baldness starts in the middle and spreads outward. A male pattern baldness starts in the front and goes backwards, so to speak. Those are the more easy, typical things, and we can see variations in both sexes. So, Rachel, what are some of those things that you have seen and heard, and some even those outlandish stories, why people will think they have thinning hair, or you've said, oh, yeah, this is why you have thinning hair?
Well, we get a lot of people, especially our lady clients, who come in and have recently been diagnosed with thyroid problems, or they've been on a variety of medications. We've heard a lot of rumors that anesthesia is bad for your hair, and if you've had a recent surgery, you can, develop hair loss from that. And then most recently, I've had quite a few patients with postpartum from just giving childbirth and say, I'm nursing, so now I'm losing my hair. What should I do? So do you think any of your services would be ideal for the postpartum patient in that instance, or any of the others?
That is a great question. And because I actually live with a resident expert, Dr. Andrea Dickerson, who is, I'm sure, delivered a bunch of my listeners out there, or their listeners' children, and so on and so forth. The great thing that women will talk about with the growth hormones and things while they are pregnant, that the hair does get longer. And how many of them are all proud of their nails, both fingernails and toenails? But once that epicenter of, let's say, growth hormone leaves after delivery, there's almost like the body says, okay, don't grow anymore. And now the hair just goes through its normal cycle, which is essentially not loss of hair, but it's the normal shedding. However, if you don't, let's say, have that hormone of that growth factor that's stimulating the hair growth, then essentially the hair doesn't grow as much, and people will say, I'm seeing more on the bed, or my hair is breaking. And that's just the normal cycle of the hair growth. So we have to kind of, go back and say, hey, your hair was going great a few months ago. This is just normal. The question about anesthesia, let's just kill that myth right now. That is something that is so highly unusual. We need to look at more, as we say, common things are common. How much are we processing the hair? A lot of it, especially for my women of color, you've seen it, traction alopecia, which is the pulling from the braids ever since they were 11 years old. And braids are very, very common right now, especially for my little girls. They can get in the pool. They don't have to comb the hair. I can tell you, even for my girls, I kept them in braids all summer just for convenience. But, those, time and time again, they're so pulling so tight, it starts to change the shape of their eyes, and they get that, what they call their edges. I mean, you've seen that before, right, ladies?
Oh, yes.
And so, but, let's also talk about thyroid. Now, thyroid hormone, or they'll say I have thyroid disease, but the vast majority of women are either taking their medicine, so there really shouldn't that be of a problem. And they like to, pinpoint hair loss, weight gain. And that's all fine and good, but once that is corrected, now the question is, okay, what are we going to do about it? Tell me what you guys are doing for those individuals that, even after their postpartum, because most of those girls don't need hair transplant. They just need a little reassurance that it's going to be just fine. But, once again, the stress of the baby can make the hair not grow as well. Okay.
Well, a lot of times women just feel bad after they've had a baby. They're just not themselves yet. Their hormones aren't quite right. So you have to kind of look at the state of mind they're in, make sure you make them happy. Make sure you're making them feel good about themselves. A little highlight never hurts anybody.
I'm highlighting mine in gray.
I
Can y'all
love
see
it.
It's
I
just
love
gray.
It's fabulous.
Thank you.
So, yeah, just give them a little change where they're feeling comfortable again, and encourage them. I always say talk to your medical doctor first, but encourage them, you were taking those good vitamins while you were pregnant. Go ahead and keep them up.
That's a great tip. Continue doing the things that help maintain growth. We've heard about biotin. We talked about keratin. It's not just necessarily those vitamins, but just making good, healthy decisions. I mean, you are. We had Jay Henry on here. Are they upcoming or have been with us? And they talk about nutrition and those good choices, if you will.
The things we put in our body definitely come out through our hair. So the vitamins and supplements and eating healthy, that all shows through your hair itself too, I believe. So I encourage the women who are just had their babies, make sure you're taking care of yourself on the inside, and it's going to come out through the outside, because it's not true permanent hair loss. It's just your hair going back to its normal state, like you said.
Gotcha. Now, we've seen, not only people with hair loss on their scalp, but tell me about some of those clients that you see, and let's talk about hair, the eyebrows or the eyelashes. Kind of tell us some of those things that are a cause of, loss of where you see them on their eyebrows or eyelashes. You guys have any of those examples?
Absolutely. A lot of problems with the ladies is they just love those tweezers and love that mirror. And so they just get in there and they start to pluck in. And over time, that hair's just not coming back, where they've just caused trauma to that hair follicle and it's just not regrowing. And so we do our best, to shape, and we all know about the eyebrow pencil, ladies. So we, get that out and fill in spots. But a lot of it is just helping them maintain the shape that they do have and work with what they have, because let's face it, no two eyebrows look identical. So you have to learn how to take care of what you have and make it look appropriate. And then there are some situations where, they really need some further help, and that's where we would recommend, seeing your physician or your dermatologist or someone like Dr. D to handle that for you.
And Tara, what's some of the recommendations you can give for eyelashes, maintenance, how to take care of them? We love the thick eyelashes, and unfortunately it's wasted on us men, and we don't really care about our eyelashes. But what are you telling those clients to educate them to keep great eyelashes?
I think one of the problems with eyelash loss right now is there's a lot of eyelash extensions going on that has a very strong glue to them that it's really heavy on the lash. The lash itself is breaking rather than falling out. And a lot of ladies think that they are losing their eyelashes when they're actually just breaking them off. So you kind of have to be cautious and figure out what you're doing with them, to know what's going on. For mascara never hurt, a little mascara, as long as you're using a good kind that's really moisturizing.
Those are fantastic things. Tell us about any issues or problems, let's say curling the eyebrows with an eyelash curler. We've heard of those myths. Is it okay? Is it not okay?
We think it's okay as long as you're using one that has the pads on the inside of it. You definitely don't want to use straight metal to the eyelash, but a lot of them have the rubber padding on the inside, which protects the eyelash from getting crimped down quite so hard. You don't want to do it hard to where you're pulling or having trauma to the eyelash, but other than that, it seems to be okay.
Now, we've had, especially I'll have clients come in that have lost their eyebrows, like you say, from over tweezing. Medical issues. We've had some, once again, trauma. Or how about, you remember back in the day when it was cool to shave a little line or part in your eyebrow? Not so sexy anymore. But for those individuals, we can literally move one hair at a time from let's say the scalp area, and put those in there. And that process just takes a few hours. And to be able to have, bushy eyebrows and then tweeze them accordingly or train that hair is fantastic. Every once in a while, we'll actually get a person who's lost their eyelashes from trauma, and we literally sew them in one at a time, if you will. And it can be, very, very beneficial because it just gives that patient that balance back to their face. I know and this probably leads us into our next thing, is just kind of how we do hair transplants.
Yeah, what we want to know about is basically what are the options, and at what stage does somebody go from, I don't want to shade in my bald spot, I need a hair transplant.
Well, this is fantastic, and I'm really happy to have Rachel and Tara here because there is some things that they can talk about in their chair that literally they can come around the corner, if you will, or down, the street just a few miles away and say, okay, what are my medical options? And one of them, and we're going to talk about hair like grass, okay? We're going to figure out, that front yard or that side yard, how can we thicken that up? Well, the first thing that we can do is we want to, of course, put down good fertilizer. Now, you guys have heard Rogaine, and you guys know that there's you can get that over the counter now. And first and foremost, we all know that nothing makes hair grow out of thin air. You can't grow grass on concrete, if you will. But the Rogaine allows us to keep the hair that we have. There's another medication out there called Propecia that actually thickens hair as well. And so for some of my older ladies in the 50s and 60s and 70s, that combination is very well. It keeps the hair that they have, and it turns thin hair into thick hair. So for you listeners out there, kind of look at your pinky and say, okay, that's a thin hair. Can I get it to looking like my thumb, which is a thick hair, which almost is double the diameter? Well, if you're repeating that a few tens of thousands of times, that can make a significant impact. We know that volumizers, shampoos, that's what they're doing. They're actually turning the appearance of the thin hair to the thick hair. So not only do we add a little fertilizer with medication and Rogaine or the topical products that my hair experts are recommending, we also can then use this little low-level light therapy. It looks like a little skateboard helmet, if you will. And there's a particular wavelength that upregulates the hair. So once again, it almost provides like the sun. And we've even shared some pictures, I know you guys can't see them here on the radio, where we've had individuals thicken their hair up so they're not seeing their scalp. And then for you ladies, do you guys have much experience using the keratin fibers or other supplements or hair pieces? Tell us about some of those other options that we have.
Well, we have fusion extensions at our salon where we can actually go in and make the hair thicker strand by infusing a bond onto the hair that's made out of keratin, which is what your hair is made out of anyway. So good extensions like that are healthy for the hair. There is also, we have the fiber powders you've been talking about. And that's good for someone who isn't quite ready to take the step like with you. It's a good way. It's kind of like the gateway drug. You start seeing your hair and you realize you can have that. So, it will color the scalp and add some oomph to the hair so that it will hide it. That's an option. And then, for someone with minor hair loss, just using some volumizing, root boosting products and a good haircut makes all the difference for just some ladies. It doesn't always take a product. It can just sometimes be the difference between a good haircut and a bad haircut.
That's awesome. And Tara, how long or what kind of maintenance do we have to have on some of these extenders, if you will? What are we telling folks that we have to, how often they should come back to get touch-ups just for their maintenance, if you will?
On extensions?
Yeah, on extensions or even the other things that we're going to do.
Well, the fiber powder is definitely something you need to use every single time you shampoo. It washes out with each shampoo. The extensions are a 6-month, they usually last around 6 months if you maintain them well. And then, with a cut, you need a cut every 6 weeks. Your hair grows, it breaks on the ends. It's time to maintain it and make sure it keeps its beauty.
Now, Dr. D, what about the people that they really do need a hair transplant? What qualifies you to have one?
Well, during the consultation, which is very important, so this isn't, when somebody comes in and says, look, I want a hair transplant, the first thing that we need to figure out is what is their goal, just like you said. And we sit down and have conversations. Do we have a high school reunion coming up? Are there any travel plans? Or do we just need to update our selfie, if you will? And so there is a, half an hour consultation, evaluation of your medical history to make sure, as we've talked about, there's no thyroid problems, there's no hormone changes. I recently had a baby. I have a new birth control implant in. Those are the things that we need to kind of talk about. Now, once we've actually, quote, played doctor and minimize any of those risk factors, for those individuals that need a hair transplant, we kind of talk about, once again, first of all, the technique. The older technique, which you can see was an incision made almost from ear to ear in the backyard on the back part of the scalp. It would be taken about the width of your pinky finger and then closed back up. Well, that is a really great option for women, especially when they have long hair, because I can take that small row of hair follicles out, close it up, and even probably fool Tara and Rachel here with my incision, because we can get a great cosmetic closure. For the gentlemen, we, and as well as for the ladies, especially if we're doing eyebrow, is we'll do a procedure called follicular unit extraction. Go ahead and Google that. But in essence, we're going to take out one blade of grass at the time from the backyard, and that's the hardiest hair that we have that usually doesn't succumb to male or female pattern baldness. And so we numb that area up. We got a little Valium-like medicine. You're snoring. You don't even care about what's going on. And literally we have almost like a hollow little drill bit that we use that actually removes the hair follicle. And guess what? We don't have to put stitches in, and it closes. So even for my listeners out there who are active duty that have to wear a hide and tight, I've got plenty of them. You can see them on my website where we've taken the hair follicle out. There is no incision, and nobody knows that we've been there. We'll implant that into the area that has a paucity of hair and just allow them to grow. And that hair is just going to be just like any other hair. It's going to grow. You can color it. You can go see the girls to get a highlight for you, if you will. And remember, it's those three phases. There's a growth phase, there's a resting phase, and then there's a shedding phase. That hair usually will lock in about a week, and then you can't shampoo it out. You can't pull it out. It'll grow, it'll fall out, and there'll be a hair follicle right behind it. And we talk about this transition even being up from 6 months to a year, and it is like watching grass grow, so we have to be very patient. But once again, having a great, hairstylist and expert of hair, as these two ladies here are, will know how to actually coach them, because they're probably going to be seeing them more than they see me during this transition, if you will. And folks can go back to work in a couple of days. You had something, Rachel?
Yeah, Dr. D, I have a question for you. Is there a particular time frame for when somebody's experienced hair loss that they should come to see you? Is there what I'm saying is there a situation when it's just too late? For example, we might have a listener out there today who's gone bald now and thinks, oh man, I just heard this radio show and I think Dr. D can give me a full head of hair now. Is that a possibility for someone?
It is a stretch, but it is possible. Now, we can actually not only remove hair around on the scalp or the eyebrows, but literally we can do body hair as well. So I have had individuals who have, the small little hamburger kind of look around the side of their head, and we need to essentially work on their curb appeal. We can take hair from the chest, the back, the legs, and put it on their hair. And believe it or not, it starts to take the characteristics as normal scalp hair. We can take hair from other places and fill in a beard or a mustache. Believe it or not, there's certain ethnicities that want underarm hair. I don't do gender reassignment, but for those individuals who want chest hair, we can move it from their head to their chest. So not only as we talked about in our laser hair removal center show, not only can we take it off, but we can move it around, which is a fantastic option for them as well.
And so the results, they're long-lasting? Are they permanent? How does this work?
Well, great question. And as you guys know, we don't wash and wax our car one time. It takes maintenance. It's haircut. It's shampooing. It's volumizing. For the hair restoration patient, whether it's non-surgical or surgical, it is your hair. Now, we're going to turn the clock back. We're going to change a few things up, but still the clock is still ticking. So for those individuals who are prone to male pattern baldness, we may have to come back in 5-10 years and do a touch-up, if you will. You've guys seen some of these patients. Any comments on those?
Well, half the time you don't even know they've had it done. You're just working on them and they might mention it. So you notice, hey, look, someone did a great job. They have hair again.
Yeah. And we understand our role even in society. And I make the joke time and time again. I'm number 3 on the list, and it usually goes hairstylist, OBGYN, and then plastic surgeon. And I'm okay being number 3. But, for the individual who has a priority on their aesthetics, they look at those 3 individuals of giving them guidance. And, I know my hairstylists know just what an important role they have just on that patient's or client's well-being.
I have a question. If we have a patient or a client in our salon who has had trauma, like a scar, like maybe they cut their head, and we can't get hair to grow back in that spot, are you able to restore the hair on a scarred area?
Oh, fantastic question. So let's talk about the individual that has that scar, or let's say has had, some surgery on the head, brain surgery, been in traumatic accident. Believe it or not only can we take that hair out and plant it in normal scalp, I can actually plant it in scar tissue. So either sometimes we'll do a combination. If it's a very wide scar, I may actually shrink that down. We'll even, for some individuals who, let's say, have a large bald spot and just can't get anything to grow, we can do a stage procedure. Some of this may be covered by your insurance, and it's called a tissue expander. So think about if we have an area about as large as your hand on the top of your head. We can't get anything to grow. The comb over isn't working for us. We can actually put a small balloon in there, and over the course of several weeks, blow the scalp up, and it almost looks like you have this really large balloon underneath your head. And what it is, and that's what actually it is, we take them back to surgery, we will remove the balloon, but now we have a lot of excess skin. So we'll cut out the scar or the place where it wasn't growing, and then we'll just overlap the hair-bearing regions. So literally in one procedure or 1.5 procedures, we can give them full coverage. We see this in a lot with kids who, let's say, have had masses or lesions removed, or bad accidents like motorcycle accidents where they've got a skin graft. But small scars, we can actually implant the hair follicles in the scar. It catches the blood supply, and it'll grow just like the rest of the hair.
That's amazing.
Wow.
Yeah. So, and that includes, like I said, whether it's on the chin or there's some individuals that that have cleft lip. And they've got their lip repaired as a child, but there's always that funny line that's sitting right in the middle of the mustache. Either the gentleman will not, wear a mustache, or their goatee is a little bit off. We can actually implant follicles right in there to give them a normal appearing beard or mustache.
And is there a certain age where, you can do the follicular unit extraction on somebody? What can we have some info on, maybe somebody's son was in an accident and has a scar?
That's a great question. So for the child, once again, they're still growing, and we have to take that into consideration, whether or not we have to essentially say we have to wait. We have to let them finish growing, or we just have to let them know that we're going to do a balloon procedure, tissue expansion, and then we're going to come back just before they go off to college or high school, and we're going to do plan B, if you will. So once again, all of those opportunities are evaluated case by case. And alopecia is once again a medical problem, so that your first initial consultation can be even run through most people's insurance visits. Or if you're seeing me for something else, that can be mentioned. Unfortunately, a lot of the reconstruction or the hair restoration is not covered by insurance. And, of course, this would be, paid for by the client.
Now, ladies, if you guys know anybody and any listeners out there, if you're interested or need information on hair loss, hair restoration, any of Dr. D's services, we're located right off of Rayford Road. The phone number is 910-323-3757. You can give Dr. Dickerson a ring, and the concierge will schedule you to get a consultation. Thank you, ladies, so much for being a part of the show.
Thank you for having us.
Dr. D, Dr. D, in 2 weeks, we'll be covering weight loss. Anything you need to know, anything you're interested in, post on our Facebook if you have any questions, and we'll see you in 2 weeks.